Welcome back to Medinare. In this video, let's discuss some high-yield MCQ questions on the topic NSAIDs and other CNS drugs. Let's look at the first question. In which of the following conditions is aspirin contraindicated? Myocardial infarction, angina, peptic ulcer, hypertension. So they are asking about aspirin. Aspirin is a NSAID, non-steroidal anti-inflammatory drug. It works by inhibiting cyclooxygenase enzyme and it reduces prostaglandin production. It is an analgesic, antiplatelet agent as well as an anti-inflammatory agent. However, aspirin also has gastrointestinal side effects. So from the mechanism of action, we saw that aspirin reduces prostaglandin production, right? But what actually prostaglandin does? It helps protect the stomach lining by promoting mucus and bicarbonate secretion. By inhibiting this, aspirin increases the risk of gastrointestinal irritation, bleeding, and exacerbation of peptic ulcer. So now let's look at the options. In myocardial infarction, aspirin is indicated to prevent platelet aggregation and clot formation. In angina, aspirin is used as a part of management to prevent coronary artery blockage. In hypertension, aspirin is not contraindicated but it should be used cautiously if there is a risk of bleeding. In peptic ulcer, aspirin is contraindicated because it can aggravate the ulcer and increase the bleeding risk and delay healing. So the correct answer is peptic ulcer. Next question is, Verrill sign is seen in digitalis toxicity, diazepam administration, Paget's disease, unconscious states. To attend this question, we should know what is Verrill sign. Verrill sign is a clinical sign seen during diazepam administration, particularly at high doses when the patient's upper eyelid droops. This is an early indicator of the sedative effects of diazepam and signals that the medication is beginning to take effect. Diazepam acts on the GABA receptors in the CNS, leading to sedation, muscle relaxation, and anxiolysis. The eyelid drooping occurs due to muscle relaxation and mild CNS depression. Now let's look back at the options. Digitalis toxicity. It causes visual disturbances like blurred vision, halos, and color changes, but not Verrill sign. So we can eliminate that option. Diazepam administration is the correct answer. Verrill sign is specific to diazepam sedative and muscle relaxant effects. Paget's disease is a bone disorder characterized by abnormal bone remodeling and it is totally unrelated to Verrill sign. Unconscious states. Eyelid drooping can occur, but this is not specifically called Verrill sign. Third question. Aspirin produces all of the following effects except. The options are prolonged prothrombin time, constipation, platelet dysfunction, gastric bleeding. So, as I explained previously, we need to remember certain things when it comes to aspirin. It is a NSAID, it is an analgesic, anti-inflammatory agent and antiplatelet agent. And regarding its mechanism of action, we should know that it inhibits cyclooxygenase enzyme and decreases prostaglandin synthesis. So with these, let's analyze the options now. Prolonged prothrombin time. Aspirin does not prolong prothrombin time. Instead, it interferes the platelet function by irreversibly inhibiting the COX-1, thereby reducing thromboxane A2 synthesis. Prothrombin time is associated with coagulation factors, not platelets. The second option is constipation. Actually, this is the correct option. Aspirin does not cause constipation. In fact, it often causes gastrointestinal irritation, leading to diarrhea or dyspepsia in some cases. The third option is platelet dysfunction. Aspirin causes platelet dysfunction by inhibiting COX-1 and thereby impairing the platelet aggregation. And therefore, this is utilized clinically to prevent blood clots. The fourth option is gastric bleeding. Aspirin can cause gastric bleeding due to inhibition of prostaglandins that protect the gastric mucosa, making the stomach lining more prone to irritation and ulceration. So, aspirin causes platelet dysfunction and gastric bleeding. due to this COX inhibition, but it does not cause constipation. Its effect on coagulation are due to platelet inhibition and not prolongation of prothrombin time. You might get confused between option A and option B, but the more relevant answer is option B, constipation. Moving on to the fourth question. Carbamazepine is a type of option A, anticonvulsant, B, antiemetic, C, anti-inflammatory, and D, antibiotic. This is a direct straight question. Carbamazepine is a type of anticonvulsant. Fifth question is, which of the following NSAID undergoes enterohepatic circulation? The options are piroxicam, phenylbutazone, aspirin, and ibuprofen. So before moving on to the options, let's see what is enterohepatic circulation. It is the process where drugs are absorbed in the intestines, excreted in the bile, and then reabsorbed in the intestines again. This leads to prolonged half-life and sustained drug action. Out of these, piroxicam is a long-acting NSAID that undergoes enterohepatic circulation, which contributes to its long duration of action. Phenylbutazone is a long-acting drug, but it does not significantly rely on enterohepatic circulation. Aspirin is rapidly metabolized and eliminated and does not undergo enterohepatic recycling. Ibuprofen has a short half-life and does not undergo this circulation. So remember, NSAID like piroxicam undergo enterohepatic circulation. They have prolonged effect and require careful dosing to avoid toxicity. The next question is, amitriptyline is which one of the following? The options are antibiotic, sedative, tricyclic antidepressant, diuretic. This is a direct question. The answer is tricyclic antidepressant. Moving on to the next question. Aspirin causes which of the following? Options are agranulocytosis, hemolytic anemia, aplastic anemia, hypoprothrombinemia. Just pause the video and recollect what all you know about aspirin and you might end up with the right answer. Aspirin is a NSAID. It inhibits COX. It reduces prostaglandin synthesis. It is analgesic, anti-inflammatory and antiplatelet agent. These are the mantra of aspirin, right? So with this, we'll move on to the options. Agranulocytosis. This is a reduction in neutrophils commonly caused by drugs like clozapine and sulfonamides, but not aspirin. Hemolytic anemia. This can occur due to drugs in individuals with G6PD deficiency. Aspirin in high doses may rarely cause it, but it is not a primary adverse effect. Aplastic anemia. This involves bone marrow suppression and is more associated with drugs like chloramphenicol, but not aspirin. The fourth option is hypoprothrombinemia. This is the correct option because aspirin can cause hypoprothrombinemia due to its effect on the liver where clotting factors like prothrombin are produced. This leads to reduced level of prothrombin and increases the bleeding tendency. So aspirin directly increases the risk of bleeding by causing hyperprothrombemia and impairing the platelet function. It does not directly cause agranulocytosis, aplastic anemia or hemolytic anemia under normal conditions. Next question is, which of the following is the antagonist of morphine? Naloxone, naloxone, nalbuphine or methadone? It is again a direct question. Naloxone and naltrexone are opioid antagonists. So in this option, they have given only naloxone, so that's the right answer. The next question is, phenothiazines are used to. The options are produce muscular relaxation, alter psychotic behavior, suppress coughing, produce analgesic. What are phenothiazines? Phenothiazines are a class of antipsychotic drugs primarily used to treat psychotic disorders like schizophrenia. They work by blocking dopamine receptors, especially D2 receptors in the brain, particularly in the mesolimbic pathway, which helps in reducing symptoms such as delusions, hallucinations, and agitation. Now let's look at the options. Produce muscular relaxation. This is incorrect because muscular relaxants like benzodiazepines or baclofen are used for this purpose and not phenothiazines. Option B is alter psychotic behavior. This is correct. Phenothiazines such as chlorpromazine are used to manage psychotic symptoms. Option C, suppress coughing. This is incorrect. Antitussives like codeine or dextromethorphan are used to suppress coughing. Produce analgesic is the fourth option. This is also incorrect because analgesics like NSAIDs or opioids relieve pain, but phenothiazines do not have analgesic effects. The next question, drug which causes gingival hyperplasia. The options are nifedipine, erythromycin, cyclosporin, aspirin. The correct answer is nifedipine and cyclosporin. I'll tell you why. Gingival hyperplasia is also known as overgrowth of the gums. Gingival hyperplasia are of many types, and especially there is another type which is drug-induced gingival hyperplasia, wherein certain drugs are known to cause this overgrowth of the gums. Three major group of drugs which are known to cause gingival hyperplasia are calcium channel blockers, example nifedipine, immunosuppressants, example cyclosporin, and anticonvulsants, example phenytoin. So let's move on to the option. Nifedipine is a calcium channel blocker used for hypertension and angina. It leads to gingival hyperplasia due to its effects on fibroblast in the gingiva. Erythromycin is an antibiotic and does not cause gingival overgrowth. Option C is cyclosporin. It is an immunosuppressant used in organ transplantation and autoimmune diseases. It causes gingival overgrowth due to its impact on collagen metabolism. Option D is aspirin. This is incorrect because aspirin is an NSAID and it doesn't have any gingival hyperplasia as a side effect. Let's move on to the next question. Which of the following drugs does not inhibit platelet aggregation? The options are aspirin, celecoxib, ibuprofen, and clopidogrel. Platelet aggregation is a process where formation of blood clots occur. Some drugs, especially NSAIDs and antiplatelet agents, inhibit the process to reduce the risk of clot formation. Aspirin irreversibly inhibits COX-1, which is essential for thromboxane A2 production, a substance that promotes platelet aggregation. Therefore, it inhibits platelet aggregation. But the question is the drug which does not inhibit the platelet aggregation, right? So option B is celecoxib. It's a COX-2 inhibitor. It selectively inhibits COX-2 enzyme and does not significantly affect COX-1, so which is responsible for platelet aggregation. Therefore, it does not inhibit platelet aggregation. So celecoxib is the right answer. Ibuprofen is a non-selective NSAID that inhibits both COX-1 and COX-2. And it can inhibit platelet aggregation although it is reversible, unlike aspirin. Clopidogrel is an antiplatelet agent that inhibits P2Y12ADP receptor on platelets, preventing platelet aggregation. Therefore, it does not inhibit platelet aggregation. So, celecoxib is the only drug in this list that does not inhibit platelet aggregation, as it selectively inhibits COX-2 and has minimal effect on COX-1 enzyme responsible for platelet aggregation. The next question is, all are symptoms of opiate withdrawal except the options are diarrhea, lacrimation, mydriasis, excessive speech. The correct answer is excessive speech. Opiate withdrawal symptoms occur when a person dependent on opiates, for example heroin, morphine, suddenly reduces or stops using the drug. Common symptoms are lacrimation, sweating, mydriasis, diarrhea, and weight loss. Excessive speech is not a symptom of opiate withdrawal. So that is the correct answer. The next question is, aspirin is avoided in children with influenza infection because of association with which of the following? The options are acid-base imbalance, diarrhea, nausea, or Reye syndrome. The correct answer is Reye syndrome. Reye syndrome is a rare but serious condition that causes acute encephalopathy and hepatic dysfunction in children. It is strongly associated with use of aspirin during viral infections such as influenza or chickenpox. Due to this risk, aspirin is contraindicated in children with viral illness, and alternative medications like paracetamol, also known as acetaminophen, are recommended for fever or pain management. Now let's look at the options. Acid-base imbalance. This is incorrect because aspirin can cause metabolic acidosis in toxicity. This is not the reason for avoiding it in the children with viral infection. Diarrhea is not directly related to aspirin use in viral infections. Option C is nausea. This is also incorrect because nausea may occur with aspirin use, but it is not the reason it is contraindicated in children with influenza. The correct option is Reye syndrome. So do remember this, that aspirin should not be given to children with viral infection like influenza or chickenpox due to the risk of Reye syndrome, which is a potentially fatal condition. The next question is, which of the following anti-inflammatory drug is a COX-2 inhibitor? This is again a straight question. The options are aspirin, ketoprofen, rofecoxib, Celitex. So the correct answer is rofecoxib. The next question is, pregnant patient can be safely given. The options are tetracycline, paracetamol, metronidazole, barbiturates. The correct answer here is paracetamol. Paracetamol, also known as acetaminophen, is considered as the safest analgesic and antipyretic during pregnancy when used in recommended doses. It crosses the placenta but has minimal risk to the fetus. It is the drug of choice for treating fever and mild to moderate pain in pregnant patients. So, what about tetracycline? It is contraindicated during pregnancy. Tetracycline is a teratogen. It causes discoloration of teeth and bone growth inhibition in the fetus. Metronidazole. It can be used in specific cases during pregnancy, especially in second and third trimesters. But its use during first trimester is generally avoided unless absolutely necessary. The last option is barbiturates. They can cross the placenta and may cause sedation, respiratory depression, and neonatal withdrawal syndrome. These are also not safe during pregnancy. So, for pain and fever management during pregnancy, remember always paracetamol is the safest option. Drugs like tetracycline and barbiturates are contraindicated due to their harmful effects on fetal development. The next question is, folic acid deficiency occurs in. The options are aspirin, phenytoin, chloramphenicol, cyclosporin. And the correct answer is phenytoin. What is phenytoin? It is an anticonvulsant which can lead to folic acid deficiency. Phenytoin inhibits folate conjugase enzyme activity and thereby it causes folic acid deficiency. By inhibiting folate conjugase enzyme activity, it interferes with folate absorption in the intestines and alters folate metabolism in the liver. Prolonged use of phenytoin can result in megaloblastic anemia, which is a condition caused by folic acid deficiency characterized by large abnormal RBCs. This is why patients on long-term phenytoin therapy may require folic acid supplementation. Also, we can correlate this phenytoin drug to the other question that we have studied recently. Gingival hyperplasia. Yes, phenytoin is one of the drugs known to cause gingival hyperplasia. So let's look at the option. Aspirin. It is incorrect. Aspirin does not typically cause folic acid deficiency. It can cause gastric issues but has no direct effect on folate level. Phenytoin is correct answer. Chloramphenicol is incorrect because chloramphenicol can cause bone marrow suppression but does not directly cause folic acid deficiency. Cyclosporin is also incorrect because cyclosporin is an immunosuppressant but primarily causes nephrotoxicity but not folic acid deficiency. So remember, folic acid deficiency is caused by phenytoin. So on long-term use, we can see megaloblastic anemia in that patient. So If you are treating that patient with phenytoin, also providing them with folic acid supplements is necessary. Next question. The muscle relaxant effect of succinylcholine lasts for, the options are 1 minute, 2 minutes, 3 to 5 minutes, 10 minutes. This is a direct question. The answer is 3 to 5 minutes. Moving on to the next question. Which of the following is true about parasympathetic nervous system? The options are acetylcholine is transmitted at both pre and postsynaptic junction. Option B, it causes dilatation of skeletal muscles. Option C, postganglionic fibers are longer than preganglionic fibers. Option D, noradrenaline is a neurotransmitter at postganglionic junction. And the correct answer is option A. Acetylcholine is transmitted at both pre and postsynaptic junction. So read these options carefully. It causes dilatation of skeletal muscles. It has no role to do with skeletal muscles. Correct? Postganglionic fibers are longer than preganglionic fibers. No, preganglionic fibers are longer than the postganglionic fibers in parasympathetic nervous system. And option D, noradrenaline is a neurotransmitter at postganglionic junction. So the answer is acetylcholine is transmitted at both pre and postsynaptic junction. Moving on to the next question. Which of the following drug induces Parkinsonism? The options are chlorpheniramine, chlorpromazine, chloroquine, chlorhexidine. The correct answer is chlorpromazine. Chlorpromazine is a typical antipsychotic that works by blocking dopamine receptors, which are D2 receptors in the brain. So dopamine plays an important role in controlling movement. Blocking its receptors can lead to extrapyramidal side effects, one of which is drug-induced Parkinsonism. Symptoms of drug-induced Parkinsonism include tremors, bradykinesia, which is slowness of movement, rigidity, and postural instability. Chlorpheniramine option is incorrect because it is an antihistamine, H1 blocker, and does not cause Parkinsonism. Chlorpromazine is correct option. It is an antipsychotic that blocks dopamine, as a result of which Parkinsonism occurs. Chloroquine is incorrect. Chloroquine is an anti-malarial drug that can cause ocular toxicity but not Parkinsonism. Chlorhexidine is also incorrect because it is an antiseptic used for mouthwashes and skin disinfection. So typical antipsychotics like chlorpromazine block dopamine receptor, which causes drug-induced Parkinsonism. Moving on to the next question. Platelet aggregation is inhibited by all except. A similar type of question have been discussed previously but with different set of options. The options given here are indomethacin, salicylates, dipyridamole, phenobarbital. The correct option is phenobarbital. Platelet aggregation, we know it's a process of clot formation. Certain drugs inhibit this process to prevent thrombosis. Indomethacin and salicylates inhibit platelet aggregation by blocking COX-1 enzyme, which reduces thromboxane A2 production. That is a key mediator for platelet aggregation. Dipyridamole works by increasing cyclic AMP levels in platelets, which inhibit platelet function. Phenobarbital, on the other hand, is a barbiturate used primarily as an anticonvulsant and sedative. It does not inhibit platelet aggregation. So by eliminating all the other options, we can come to the conclusion that phenobarbital does not cause platelet aggregation. The next question is, the first choice of drug for petit mal seizure is, the options are phenytoin sodium, carbamazepine, phenobarbital, none of the above. The correct answer is none of the above. So, which is the correct answer? So, which is the first choice of drug for petit mal seizure? Petit mal seizure are also known as absence seizures, characterized by brief episodes of loss of consciousness, often with blank stare and no convulsions. The drug of choice for absence seizures is ethosuximide. It is the most effective and safest medication for this type of seizure. Alternatively, we can use valproic acid, especially if other type of seizures coexist. For example, generalized tonic-clonic seizures. Why not the other options? Phenytoin sodium is incorrect because it is used for tonic-clonic seizures, but is not effective for absence seizures. Carbamazepine is incorrect because it is used for partial seizures and generalized tonic-clonic seizures. Carbamazepine can worsen absence seizures. Then phenobarbital is an older anticonvulsant. It's used for tonic-clonic and partial seizure, but it is not the first line of choice for absence seizures. So first line of choice is ethosuximide. None of the above is the answer. The next question is, which one of the following muscle relaxants has the maximum duration of action? The options are atracurium, vecuronium, rocuronium, doxacurium. And the correct answer is doxacurium. Muscle relaxants are classified based on their duration of action as short acting, intermediate acting, and long acting. Short acting durations is up to 20 to 30 minutes. Intermediate acting drugs duration is up to 30 to 60 minutes, and long acting durations are more than 60 to 90 minutes. Doxacurium is a long-acting, non-depolarizing muscle relaxant with a duration of action of approximately 90 to 120 minutes. It is metabolized slowly, which contributes to its prolonged effects. Atracurium is intermediate acting for 20 to 40 minutes. It is metabolized by Hoffman elimination and Hester hydrolysis, leading to shorter duration. Vecuronium is intermediate acting again, which is for 30 to 40 minutes. It is metabolized in the liver and excreted in the bile. Rocuronium is intermediate acting for 30 to 60 minutes. It has a rapid onset but does not last as long as doxacurium. So the correct answer is doxacurium. The next question is, benzodiazepine antagonist is? The options are flumazenil, furazolidone, naloxone, naltrexone. The correct answer is flumazenil. Flumazenil is a benzodiazepine antagonist. It works by binding to the benzodiazepine receptors on the GABA A receptor complex in the brain, which reverses the sedative effects of benzodiazepine. It is commonly used to reverse benzodiazepine overdose or to counteract sedation in procedures where benzodiazepines are used. It's used in case of benzodiazepines poisoning. Furazolidone is an antibacterial and antiprotozoal drug and is not related to benzodiazepine antagonism. We know naloxone and naltrexone are opioid antagonists. We have discussed this previously. Moving on to the next question. Which one of the following NSAIDs has adverse effects on the liver? The options are acetaminophen, aspirin, ibuprofen, diclofenac sodium. And the correct answer is acetaminophen. Acetaminophen, also known as paracetamol, is not traditionally classified as NSAID because it lacks anti-inflammatory properties, but it is commonly used as analgesic and antipyretic for pain and fever. Acetaminophen has well-known hepatotoxicity, which is liver toxicity, especially when taken in overdose. Chronic use or overdose can lead to acute liver failure due to accumulation of toxic metabolites, particularly in individuals with pre-existing liver conditions or those who consume alcohol regularly. Aspirin, ibuprofen, and diclofenac sodium can affect liver, but in rare instances. Acetaminophen is the most significant NSAID-related drug when it comes to liver damage. So the correct answer is option A, acetaminophen. Moving on to the next question. Atypical antipsychotic drugs are all except olanzapine, clozapine, risperidone, thioridazone. The correct answer is thioridazone. We have classical antipsychotic drugs and atypical antipsychotic drugs. Classical antipsychotic drugs are chlorpromazine, haloperidol, zuclopenthixol, and thioridazine. All these classic antipsychotic drugs act by blocking dopamine D2 receptors. The other group is atypical antipsychotic drugs, where we have clozapine, olanzapine, and risperidone. These act by blocking 5-HT2 and D4 receptors, and they have weak D2 blocking action. And that brings us to the end of this video. I hope you guys found it helpful. Do like this video and subscribe to Medinare for more. Thanks for watching.